Hello, everyone. So, this is my informative speech on labor and delivery nurses. And the reason why I chose this topic is because this is the field I'm hoping to specialize in. And I really wanted to really study what a job of a labor and delivery nurse is specifically and what the importance of their job is so that I can do better and be better when I become a labor and delivery nurse in the near future. So the reason why I chose to do this is because when I delivered my first son, I had a horrible experience with my nurse who I was in labor with. So when I delivered my first son, I had to be induced, and for anybody who's experienced that, obviously knows it's a very horrific experience, very nerve-wracking, especially at 19 years old. So I went in to be induced, and I had went over my birthing plan with my nurse. I had told her that I didn't want to use any kind of pain medication. I had to be monitored for high blood pressure, and I just kind of wanted a relaxed and comfortable environment and to kind of do things on my own as I needed. And so because of my high blood pressure, I had to be monitored every 30 minutes for vitals and blood pressure. So every 30 minutes she came in the room, she asked me if I would like an epidural or if I wanted any pain medication or any pain management, even when I had first gotten there and the contractions were not even prominent or needed any kind of pain medication. So during that time, it was very stressful, as anybody who has ever watched their partner or their spouse deliver a child knows that it's a very stressful and beautiful time. So with her not doing the job I thought was adequate, I guess I feel different about it. But according to the nursing.org, quote, the labor and delivery nurses help assist pregnant women throughout the childbirth experience, from early labor and throughout delivery, and their immediate postpartum needs, unquote. So to me, that means following birthing plans, listening to what the woman has expressed and what she needs, and what she expects and needs for her baby, and following the other postpartum needs that a woman experiences throughout this time. And so for me, learning exactly what the nurses and what is needed of labor and delivery nurses specifically really helped me narrow into what I'm hoping that I can achieve and be a positive part of every woman's labor and delivery story that I get to be a part of in the future. It really helped me connect in a way that I didn't think I would, researching it, figuring out exactly what the job of a labor and delivery nurse and what is required of us specifically, and looking throughout more of the details, which I won't go into now, but finding the actual job required of a labor and delivery nurse and hoping to be a positive impact of every story that I get to be a part of. I know for me specifically, obviously my nurse is brought up, and every time it's always a negative experience for me on her part. So for me, I hope to be always a positive experience in a woman's story that I get to help on. And according to the best Master of Sciences in nursing, they say, quote, while all nurses have important jobs, perhaps few nurses are as unforgettable for their patients as a labor and delivery nurse, unquote. And so that kind of helps tie back into the my beginning story. Being a labor and delivery nurse is very important. It has a very positive impact or negative impact. For me, I had a very negative experience my first go round, but a very positive one my second go round. My nurses were great and everything went great. So my birthing stories are very different, and they vary a lot. And that's all based on the nursing care and the doctors that I had during both. All the staff is important, of course, but especially nurses during that time They play a very important role. And so knowing and researching about what the importance of being a nurse is, what their job really requires, just pushes me to do better. And I really hope that when I am a nurse in the future, that I can always be a positive impact of their birthing story. And for the baby's needs, of course, as well. Making sure that their needs are met, and the mother's needs are met, and the spouse's needs are met. That was another big part. So that ties it up, and thank you for watching.